is a demonstration of a complete urinalysis test. So first thing you're going to do is you have your urine sample, and you're going to make sure that you look at the physical characteristics, and if you'd like to hold it up. So it depends on what the color is, and of course what your SOP says, but that has a yellow color to it, and I can see things floating in there, so it might be cloudy, or depending on how much how many particles are in there. So you have to take a note of that, because you're going to eventually need to tell the analyzer that. So before we do any testing, we want to do quality control. And so with quality control, we have a level 1, which is typically our normal control. We also then have a level 2, which is our abnormal control, because we want to be sure that the strips that we're using are able to be both positive and negative. And so we can't see the physical characteristics, so on the analyzer we will just put other for color and other for clarity when the time comes. So this particular analyzer, you should have it set up so it can have its full functioning. And so anytime that there's a new person that's doing the testing, we want to identify who it is that's doing the testing. It's part of the audit trail with the results. And so usually the first thing that you're going to do is turn on the analyzer. So you start the analyzer by pushing that front button firmly, and it's going to go through a bit of a system check, making sure that it's electronics and it's feeling just fine, and there's a bar going, and it's pulling out the tray. She's going to go ahead and just do an alcohol wipe of the tray. You hope that the person before you had cleaned it, but just in case, you don't want to have cross-contamination. And really you should do this between your urine samples. And then she's going to go ahead and hit strip, because we're doing a strip test. You then have to enter your operator's name, initials, or sometimes you're an employee number, so whatever it is that you do, to be able to trace who's doing the test. Then you want to put in your patient's name, and she's doing QC1. Okay, you always want to be sure you clearly identify and label what it is that you're doing. And then she's going to get a strip out. And then these QCs are ones that you just spread a sample on over to make sure that each pad has it. And everything's timed, so this is the hard part. And she has yeah. Oh, did she get it? Good job. And so now, while it's waiting and doing its countdown, so if you were doing it manually, you would have to watch your time, but the analyzer is doing it for us and is going to read each pad at the appropriate time. So it's asking us at this point, what is the color? And since it's a QC, we don't know what color, so it's giving us different colors, and we're just going to find other, enter, and it's going to ask us for clarity. There's a bunch of choices, and since we can't see how clear it is. And so having done that, it's taken up most of the time, and in about 4 seconds, the answers are going to start printing out. It's so much nicer to have this, because the analyzer is standardizing the reading time and standardizing the color that it's detecting. So with our QC1, we take a look at it, and it's documenting who is doing the test, what the test is, and the different values. So glucose, bili, and so on. And we're going to then document and compare to make sure that the QC results are acceptable. So you're going to go ahead and do the next test. So using the second level, again, making sure you take responsibility for your testing. She's putting in that this is QC2. It's also nice if you wanted to label it with the lot number, but whatever it takes to clearly identify that you're doing quality assurance, quality control, and what the lot number and level it is. And QC will be done according to your facility's standard operating procedure. Typically it's done at least once a day. Oh. Well, this is one of the hard parts. You have to be fast enough. For me, sometimes I have a hard time just getting it onto the, if I have too much coffee, it's like trying to get it located on there. So you only have 8 seconds, so we'll just have to repeat it and try again. But that happens. Sometimes you're just not quick enough. So you have to re-enter what the test is that you're trying to do. And this is QC2. And again, get your strip out. I like to make sure I have everything, ready to go, because that 8 seconds goes really fast. Okay, so you're going to hit start, and so you want to one hand's hit start, and the other hand put the QC on it, blot, and get it on that. And that happens too. There, she won. And now it's asking for the color, and this is QC, so it's other, asking for clarity, it's other. You're fast doing that because now you have 33 seconds, and so right now it's timing the reactions that are required. Some of them are need 30 seconds before they're read, 40, 45, 60 seconds, and the last one is 120 seconds. And so it's already reading some of these earlier ones. It's now just waiting for this last one to be read. And there it comes out. And so there's a special area that you'll document your quality control. And if it's attached to a computer, it would go right into the computer system, which is really nice. In Student Lab, we will tape it to the appropriate QC document pages. So finally, now we are going to do patient testing. So the urine has been collected by the patient, and then that urine has been put into this specialized container. This clinical sample in this tube would have gone onto an analyzer, which will do the testing and pipetting for us instead of us dipping it. So that's how often it's done in the clinical lab. But we're going to need to be sure we carefully get that strip all the way into the urine, and then, okay, let's see how well she does. 8 seconds, no pressure. Dip. Good job. it didn't like it, I guess. Misplaced strip. So we thought you got it there. So it has to be right on. So it's like Monopoly, no pass go, don't collect $200. You'll have to start all over again.
All right.
So wipe your tray. That's why in student lab it's so important to practice your psychomotor skills. That's hand-eye coordination. Just like with phlebotomy, I can't have too much coffee because if you're a little shaky, it can be hard to get that strip into that spot. Those strips you take out.
Filmed.
Those strips come out. They need to be one at a time taken out because those strips don't like daylight or humidity. So you always just do one test at a time. Out, drag. Good job. 1 second to spare. Yeah, like it. So now it's asking for color, and so she, the tech, you, the student, have to decide what color it is. We'll try to have some color charts.
By accident, I pushed yellow and clear instead of other.
Oh, so
I'll be having to correct that on the strip once it's generated by putting my initials with the correction and indicating that instead of yellow clear, it's yellow cloudy.
awesome. So most urines tend to be this nice yellow, normal yellow and clear, and so there is a spot on the analyzer to let everyone do it quickly. And it's excellent that you noticed that that's what you did. You want to be sure that you put in properly what is actually the physical characteristics that you really want to be reported. So that's just a corrected entry. Then you're going to make an assessment if it needs to have a urine microscopic, and that will be dependent on your standard operating procedure. Often we're looking at the results of the leukocyte esterase, the nitrites, and again your clarity, color and clarity often also have a role. So in this situation, it's cloudy. Is there anything else that's interesting? The nitrite and the leukocytes are negative, and the blood is negative. So some places with that, if it was clear, colorless as you, or clear and yellow as you had indicated, you wouldn't have had to do any microscopic. But because it is cloudy, we're going to want to see why it's cloudy. Oh, and the protein is high. So we want to go take a look to see what the microscopic elements are. So that would be another video.